I've been told that there have been some snake sightings around some of the Queensland campuses lately. If you do think you've been bitten by a snake, the very first thing you want to do is call an ambulance and make sure you don't move. So first of all, how do you recognise a snake bite? You might think that it's going to look like 2 puncture marks, which would be common sense. More commonly, it'll just look like a scratch. That'll be where the snake has partially got you and done a partial envenomation. And there's a couple of things you definitely don't want to do. One of them is don't cut the wound or try and suck the venom out. That's a very old myth, but one that does still stick around. That's not going to work, but it will introduce infection into the wound. Definitely don't try and catch the snake. This is one that people do because they think it's going to be helpful. The hospital absolutely doesn't want you bringing a live snake in there. And if the snake hasn't bitten you the first time, it's definitely going to get you the second time. If you have access to a first aid kit, either in your car, on your person, maybe at your place of work, they will most likely contain a bandage that looks like this. It's a tan bandage called a pressure immobilization bandage. But you can use anything for this. You can use a normal bandage, you can even use your clothes if you have to. But let's presume that you do have access to one of these bandages. By putting a very tight bandage around the limb, you can compress that lymphatic system and actually keep the venom in the limb, as long as the person doesn't move that limb and help the venom move along. So you want to identify the bite and put your first immobilization bandage very tightly over it. You pretty much can't go too tight with these, but the guidance is that you shouldn't be able to comfortably put your finger under the bandage. We want to wrap the entire limb all the way up to the joint. So on the leg, that'll be up at the hip, and on the arm, that'll be up at the armpit. Now I'm going to go for my third bandage here. If you only have access to 1 or 2, you can skip that very first step of using the first bandage to wrap around the bite and just start down at the toes and start to work your way up. You make sure that the victim doesn't move. Any movement's going to keep that venom working along. As long as the pressure immobilization bandage is applied and the patient is kept still, there's a very, very little chance of them having a bad outcome. The last thing is don't wash the bite. The hospital will do swabs of the bite and they can then match the venom to their anti-venom that they want to give.